I mean, it's fascinating that you wrote your book before COVID and lockdown. How do you feel the issues that you raise in your book have been amplified by COVID and lockdown?
They have been amplified. As I said, before this, people suffered from isolation, even kids. Everybody thinks we're so connected. I always think we're huddled in our little corners, dark corners, sending out a tweet like a flare from the sinking Titanic. We had this problem before, and with lockdown, obviously it's much more prevalent. But I wrote the book not to say let's be cheery or let's look at the positive side, but my ambition was for me to look at where there was hope when we're too isolated, and we have been. We need to work as a community because it's only humans that can make you feel that you're with somebody has your back. And how come we did this hundreds of thousands of years ago? We knew how to sit around the fire. Okay, it wasn't easy. There was a hunt. Some people were picked off, but we were together, and that's how we're born to mingle. And those are the rules. And then
But wait, Ruby, you've just said we're born to mingle, but now we've been told we can't mingle. The atomization of society is now by law. And how is that going to affect people's mental health and your mental health?
Do you want me to go to the bad news?
Yeah.
I mean, it's going to be the next pandemic. And what's so what's so ironic is that nobody's getting ready for
it. There was a survey a week or so ago by Demos that said that COVID is now a more divisive issue than Brexit because you've got half the country thinking, this is insane, we've got to get on with our lives, it's not enough just to be alive and to protect people from a deadly virus. We have to live. And the other half of the country is now so terrified of the deadly virus that they've seen every single night on the news that they are not leaving their houses.
Yeah. Well, I had a discussion this morning. Do we need to have the facts? Okay, then get off it. I need to email, but after my 10,000th, I'm getting ill. So we have to be weaned off this constant death toll every night. But, we're human. Somebody's got to say, it would be better for your health. Here's the news. And now read Ruby's book.
Do you think it would be clever and probably better for the country and in the world if you didn't have the nightly death toll and the nightly infection rate and the nightly hospitalization? That's just bad news. And we need to park the bad news and have some good news in our lives.
What can I say? I completely agree.